Good morning, Ketchikan. This is Mandy Holstein again, Power of Wellness Health Clinic. I've been doing videos daily for the community on this whole COVID-19 situation unfolding in Ketchikan, our state, and the country, and the world. Pandemic. So we have a Facebook page going, Ketchikan Spread Calm, Not COVID group actually, and then my business page, Power Wellness Family Health Clinic, and then also YouTube channel. If you search Power Wellness Family Clinic, that will bring up our YouTube channel with our videos that we're posting daily. Pretty rudimentary videos, as I went through before. At some point in the future, they won't be as rudimentary on a phone, but that's what we got for now, and there's no better time to get information out there through social media than when we're all trying to practice social distancing and we're quarantining ourselves and etc. So I had a viewer request to do a video on signs, symptoms of COVID-19. As we all know by now, there are the two categories. Either you are severely ill to the point where you need hospital services, or you're sick and you're experiencing symptoms that are very similar to a lot of other diseases and colds and coughs and things that we have going on a daily basis. So it's like, how do you differentiate between the two? Am I spreading it? If I'm asymptomatic even, I could be spreading it. I'm not getting tested. How do I know if I have it and I could be giving it to somebody else? Well, let me tell you first of all that there are not enough tests to go around the state of Alaska or the communities to electively test people. That might be something that is subject to change in the future when our resources kind of get ramped up. There is a test available now that will give you results in 45 minutes. It's a really quick screening mechanism, but I guarantee you it's not going to find its way to Ketchikan, Alaska for a while probably. So just at this very moment in time, we are only screening patients where truthfully they meet criteria, but also will it change the outcome of their treatment? Anytime a provider orders any type of diagnostic, you always have to think, okay, what benefit is this going to lend to that patient's plan of care and their potential treatment and their potential rehabilitation? If there is a change to your course of action and your treatment plan, then yes, absolutely, you should perform that diagnostic. And if there's going to be no change to your plan of treatment, if it's just simply knowing, right, information, when resources are scarce or when we should be conserving resources, that simply is not good enough. I mean, it would be nice if we could just screen everybody and their brother. That would solve a little bit of the issue. But if we're not taking universal precautions, prevention, standard stuff, it's all for naught anyway. So what I was gonna say, I'm gonna try every time I touch my face, use hand sanitizer. What I'm going to really try to do today is, what should you do if you're experiencing illness symptoms? What is our state requesting that you do? Countrywide, what are people being asked to do? There's also a really nifty little COVID-19 system checker, symptom checker that's available online. I'm also going to be going into that as well. Okay, so first question, how do I know if I have a cold or if I have COVID? If I won't meet criteria for testing and I'm at home and I have even just mild symptoms, a mild dry cough, a low-grade fever, maybe a runny nose, maybe a sore throat, maybe body aches, maybe chills, I'm trying to make a decision, what should I do? First question, how do I know it's COVID-19 versus something else? Easy answer, you don't. You really don't. You don't know if it's COVID-19 or if it's something else. There's no way to know until we have testing kits available for man, woman, and child, so that we can segregate with between COVID-19 and other illnesses. You have no idea. So if you have any questions, first of all, Contact your healthcare provider. If it's an emergent situation, by all means, go to the emergency department, okay? They have a triage tent outside the door to actually triage folks coming in who are ill, specifically for the ER. That is an ER visit, as I mentioned once before. But long and short of it, call your healthcare provider. There's no way for us to know whether this is COVID-19 or if this is something else. If you are in an emergent situation, you go to the ER and you practice universal precautions to prevent the spread of COVID-19. Not only do you socially distance 6 feet in your house, you should also quarantine yourself. If you have family living with you, you should quarantine yourself to one room and one room only to prevent contamination with your family members. You need to go on lockdown for a minimum of 14 days. You need to monitor yourself for worsening of symptoms, the progression of the illness, and you need to lock your family down. I'm sorry. Quarantine. Your whole house should be on quarantine for 14 days. All of the information thus far says that in that 14-day period of time, people either do phenomenally well with this virus or they do not do so well. And usually the people that are not doing so well, past day 7-ish, it seems that people then decline, are the older, the people with immunocompromised status, comorbid health conditions, heart disease, cancers, different things like that that have a lower immune system. And unfortunately, that's the group of people that this is taking the toll on, okay? So quarantine yourself. If you are in an emergency, go to the emergency room. Call your regular healthcare provider. They can triage you over the phone. Healthcare providers are knowledgeable in this area and what's going on in your local community. And follow standard universal precautions. Social distance 6 feet, all members of your house. You should be quarantining yourself to one room in your house so you don't spread it to your other family members. Your family members need to quarantine. Practice good hand hygiene. Cover your cough, etc. Question number 1. What do I do if I have cold symptoms? All those things. No going to work. Work from home. Quarantine. Stay home, people. Stay home. Something I almost forgot to mention with this supportive care at home, you feel horrible with flu-like symptoms. There is emerging evidence to show using an NSAID, a non-steroidal anti-inflammatory, could cause a detrimental outcome during the course of this illness. Specifics as to what the detrimental outcome is, it's not completely known, but for now the recommendation is that you avoid the non-steroidal anti-inflammatories, that group of NSAIDs, if you suspect that you have COVID-19. As I previously mentioned, there's really no way for us to know, so unfortunately at this moment in time the recommendation would be to avoid those products, the NSAIDs. NSAIDs specifically, they do not include Tylenol. Tylenol is safe for you to use unless you have been told not to use it by your healthcare professional, or if you have a liver problem, fatty liver disease, elevated liver enzymes on your lab panel, or if you have hepatitis or something else that affects your liver. Do not consume Tylenol with alcohol either, because they're both metabolized through the liver and can cause you harm. If you have any more questions as to whether or not Tylenol is a safe choice for you to use if you're using it to support yourself through an illness, you need to be contacting either your pharmacist or your healthcare provider, okay? Healthcare provider first, because a lot of times they know what your health conditions are. They're going to be able to walk you through that. If you're unable to reach your healthcare provider, if you simply don't have one, ask your pharmacist, okay? Those are the 2 recommendations I would give you. Do not just Google it. Ask a healthcare professional who knows exactly what it is that they're talking about, and they can think if it's going to be good for you or not. Tylenol, so that's okay with that caveat, okay, that I just mentioned. Ibuprofen is an NSAID, non-steroidal anti-inflammatory drug. Ibuprofen, Aleve, naproxen, aspirin. Those are the types of medications in that group of NSAID, okay? So really consider that. If you are on a baby aspirin, 81 milligrams a day, because you have some type of cardiovascular issue, or you've had a heart attack, or if somebody's worried about you having a heart attack, you need to consult your medical provider first. Do not just stop taking, if there's something that you've been on and it's been prescribed and recommended, okay, do not abruptly discontinue it without consulting with your healthcare provider first, okay? What I am saying is that ibuprofen and Tylenol we usually use during a cough, cold, fever, the flu. You might want to avoid the use of ibuprofen right now because of COVID-19. That is all I'm saying. If you have any questions about this information, you need to contact your healthcare provider or a pharmacist. Okay, last part of the video, as I mentioned before, there's this really neat little coronavirus symptom checker that's available online. I did go onto it last night, and it looks like it was released, or it's supported by the Office of Critical Event Preparedness and Response, the Emory University School of Medicine, and the Department of Emergency Medicine. So what I ended up doing, I was sick about 6 weeks ago, very, very ill. I just typed in my symptoms to see what the recommendations were, and they were spot on, fantastic. So I'm going to go ahead and give you this address. You can type it into your phone browser, you can type it into your computer, whatever internet browser you're using. I'm also going to paste it into the comment section below the link so that you'll have availability on that. What I have pulled up here is https colon, so the dot, right, and then // C as in Charlie, 1919 there, C as in Charlie, H as in hotel, E as in echo, C as in Charlie, K as in kilo, .com. My husband would be proud, see, using the military, .com /START, start, okay? So I'm going to show you, it's rudimentary, bear with me. I'm going to show you. Okay, so this is the last part of the video. This is the symptom screener, the symptom checker. It's in its beta stages for all of you techies out there who know what that means. I know it's important, but I don't know what it means. There you go. It's in its beta stages. It is offered or backed by the Office of Critical Event Preparedness and Response, Emory University School of Medicine, Department of Emergency Medicine, so those are some pretty reputable sources. I did plug my symptoms. I was sick about 6 weeks ago. I plugged in my symptoms to see what the recommendation would be, and it was spot on from a healthcare perspective. So I'm going to take you through this here. You can find this at https://c19check, check.com/start, START. Link is going to be in the comments on YouTube. So let's go ahead and click get started. Terms and conditions basically saying, you know, this is in its beta stages of production and that we're not going to sue anybody if they give us wrong information. We accept and we start it. Of course, you're going to be a diligent consumer and you're going to read those terms and conditions, right? Okay, tell us your symptoms, get an idea of whether the symptoms you report suggest that you may have COVID-19 virus, and then see what to do next. So as you can see, this is really a blueprint of what you should be doing. And this keeps you from having to call your healthcare provider. This keeps you from, just showing up to your healthcare provider's office or even to the ER. Of course, if you have any questions about this information, you do need to call your healthcare provider, ask what they think. If you're in an emergent situation, you do absolutely go to the ER. Okay, so let's go ahead and type in our age. Let's just say we're 45 today. And what symptoms do we have today? Let's see. Let's say we have a fever. Let's say we have a cough. Let's say we're tired. We have body aches. Man, this feels like the flu, headache. Let's just say no diarrhea for now. There are cases where patients are reporting diarrhea as the first sign. No sore throat, no itchy red or pink eyes, but let's just say we have standard flu-like symptoms and we have a cough that just developed. From what I understand, the cough is a dry cough, so. All right, so since you've become sick, are you having any of these life-threatening signs? So this is their way of triaging you to see if you meet criteria to go right to the ER, okay? So let's just say for now, we don't have any of these signs going on. We're just at home, we feel like crud, we feel like we're getting the flu, but we have this cough and we're worried we have COVID-19. So let's say none of the above, no emergent symptoms, okay? And this one is where they ask about other co-occurring medical conditions. Basically, do you have comorbid conditions that could increase your detrimental outcome from this? Are you in that high risk category? So you can see here, pregnant, sickle cell disease, immunocompromising conditions right here, HIV/AIDS, hemodialysis, another immunocompromising situation, diabetes, very overweight. Patients that are morbidly obese can have respiratory issues, among other things. Smoke, okay, so for those of you who smoke, that is really number one for complication, okay? Asthma, cystic fibrosis, so these are all of the respiratory conditions. So clearly this is a virus that specifically affects the respiratory system. So if you have any of these comorbid conditions, or if you're a smoker, that puts you in a higher risk category automatically. So let's just say we don't have any of these. Let's say that we're just a 45-year-old individual, we're having a dry cough, flu-like symptoms, we feel terrible. No emergent symptoms, and we don't have any comorbid conditions or anything that would lower our immune response. And then it asks where you're located, and partially this is to determine what resources are available in your area. So let's just type in Ketchikan zip code there. And you have reported symptoms associated with COVID-19, okay? Please self-isolate by staying at home unless your symptoms become more severe. So this is what we were talking about earlier, okay? You automatically self-quarantine. Your symptoms are not severe enough to seek ER treatment. Technically, with a shortage of test kits, they're not severe enough to even screen you. There's simply no way of knowing if you have COVID-19 or not, so you need to take universal precautions in preventing the spread for that. The symptoms you report have commonly been observed in people with this infection. You do not appear to have any medical conditions that are currently thought to put individuals at higher risk of severe COVID-19 illness. If you are still worried about your condition, consider calling your doctor, a nurse advice line, or call center to discuss your concerns rather than immediately leaving the house to seek testing or treatment. And again, this helps reduce the spread, okay? If you self-quarantine and you stay at home, all right? Who to call, they give advice. If they're, look at this is fantastic. Call your state hotline for Alaska, 211, right there. This is amazing. CDC, 1-800-232-4636.